While caring for the first patient to test positive for the Ebola virus in U.S. soil, a Dallas nurse contracted the disease. The woman, identified by WFAA-TV and her church rector as Nina Pham, remains in isolation at Texas Health Presbyterian Hospital, where she also works. Since the weekend, hazardous materials crews have been cleaning her apartment, catching neighbors off guard.
When they said that it was a nurse, we all kind of looked at each other and we were like, wait, is it her? And my boyfriend and I were talking, and we were like, well, we just saw her walking her dog, so she looked fine then.
A person who was exposed to Pham while the 26-year-old may have been contagious is being closely monitored. Authorities say Pham's dog was also inside the apartment. They do not believe the pet has any signs of Ebola. The city is now taking care of the dog at an undisclosed location. Cleaning crews also continued work at the hospital, where the first Ebola patient, Thomas Eric Duncan, was treated and later died. Pham's name appears often in Duncan's medical records, which his family provided to the Associated Press. The records show she was in his room in full protective gear the day before he died. The Centers for Disease Control and Prevention says the nurse somehow became infected from a breach in protocol. A national nurses group says this proves American hospitals are ill-prepared for the deadly virus.
To blame the nurse, not even knowing what had happened, I think is really wrong. We have been requesting training, equipment, the highest optimal level of equipment, including hazmat suits, for a while.
Concern for healthcare workers and public safety has driven demand up for personal protective equipment. Medline, a distributor of masks, shields, and eyewear, says sales are up 40% in the last 30 days. And the production line is humming at Prestige Ameritech. It makes fluid-resistant face masks.
If we activate all of our equipment in a full pandemic mode, then this facility can produce roughly 1 million products a day.
While suppliers churn out the safety gear, federal health officials say they're redoubling efforts on training those who could treat Ebola patients. John Moe, Associated Press,